I want to get into first what is causing the disrupted sleep. What are the biggest things that you see? And then also, what are the tools to get things back in alignment? Because, like I said, easier said than done.
Absolutely. And I think that one of the biggest challenges that many people who are struggling with their sleep experience, the kind of misinformation from their clinicians of, I'm struggling with sleep, and they get told sleep hygiene. And the thing about sleep hygiene of, oh, well, make sure you have a bedtime and do all of the things, no cell phones, all of that. Sleep hygiene alone has never, ever, 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 ever been shown to actually fix a sleep problem.
Mm.
And the analogy I use to help people really reinforce, because they go, well, that doesn't make sense. We should be doing those things. Well, if I went to my dentist and I had a cavity, they wouldn't send me away and say, brush your teeth more. They would first drill a hole, fill it, do the intervention, and then tell me, brush your teeth more. Sleep hygiene is supposed to be a part of the interventions for whatever the problem that may exist. And the reason I start off with that as a response to your question is because when we're looking at sleep disorders, the International Classification of Sleep Disorders, Edition 3 Text Revision, which is our current manual, identifies over 70 different sleep disorders that can possibly exist. So first and foremost, recognize that we should never take a one-size-fits-all approach, that reasons for your difficulty to be able to fall asleep, stay asleep, feel refreshed, have sleepiness during the day may be very distinct from someone else who may have very similar symptoms. And so the way to best own what your own journey will look like is really characterizing for yourself first, what am I struggling with? If you go to your clinician or your healthcare partner to say, I'm not sleeping well, they're going to give you a one size fits all response, like sleep hygiene. If you go in and you're describing, I'm having difficulties falling asleep, they're going to then ask the questions, well, tell me about what's going on. The things you've described are very commonly encountered as a reason for people to have sleep initiation insomnia, is that I know I need more sleep. I know I have a lot of things I need to get done during the day. I have to be in my best position in the day in order to get more done. And therefore, I start to ruminate about what are the consequences if I don't fall asleep right now. And I start doing that mental math of making the calculations. If I fall asleep right this second, this is how many hours of sleep. And now I start generating that anxiety. And so in those types of situations, we want to really identify that as the culprit, and very frequently are going to use strategies such as cognitive behavioral therapy for insomnia to help in redirecting those behaviors to things that are less maladaptive and more adaptive to that issue. It is important to also know that depending on the age of the individual, we may see different things that are contributing to why we're having difficulty falling asleep or staying asleep or being restless. I know one of the things that you and I had discussed is a lot of the people who are listening or are tuning into this podcast are women, and they're women who are probably close to our age who are experiencing those perimenopausal and menopausal changes, which are already dysfunctional enough. And recognizing when women are asked if they're familiar what these symptoms are or when they're occurring, more than 50% of women don't even know what phase they're in. So there already is this call to action of, I need to better understand what my body is experiencing. You then layer in the fact that it not only disrupts your entire day, but it then wreaks havoc on your night. And so many times we're trying to address the daytime without realizing those nighttime symptoms are part of the reason as to why you're having a dysfunction, but they're all being based in that hormonal dysfunction.